The nation recorded the highest COVID-19 tally for the week, with cases of coronavirus variants continuing to rise. Authorities tightened foreign entry guidelines. Yeon-seung brings the updates.
South Korean health authorities are toughening entry guidelines to stop the spread of coronavirus variants. The government will no longer issue quarantine exemption certificates to visitors from countries with reported cases of variants, except for in the most extreme circumstances. Also, from February 24th, all overseas arrivals, including South Korean citizens, will have to submit in a negative test to enter the country. This means that all incomers will have to take the COVID-19 test 3 times, once before coming into the country, once right after arrival, and then another right before the end of the 2-week quarantine. Local governments will also designate directors of overseas entrants to monitor those in quarantine more closely and make sure that they're following all the rules. These measures are in response to the total of 80 variant cases that have been reported recently. Variants of virus have spread to 14 local residents as a result of ignoring quarantine guidelines. Meanwhile, daily COVID-19 cases in South Korea climbed back above 400 for the first time in 6 days. Wednesday saw 444 new cases, 414 of which were local infections.
The reproduction number indicates COVID-19's ability to spread, and that number has continued to rise in the last 4 weeks and has reached almost 1.0 from 0.79. Especially in the capital, the number has gone slightly over 1.
As of Wednesday, health authorities have found a total of 96 cases traced back to a religious gathering called the Eternal Life Victory Altar and an academic institute in Ojonggu district. 24 of those infected are over the age of 60, including 5 in their 90s. With millions of people expected to travel for the Lunar New Year, health authorities will spend the holidays on their guard. Yeon-seung, Arirang News.